We are an independent clinical research site, 100% dedicated to conducting clinical trials for rare diseases. Rare Disease Research was founded in 2017 by Dr. Han Fan, a pediatric neurologist, to improve access to clinical trials for rare disease patients.
We recognize the issue, we recognize the problem, and we recognize the downstream effect of the long startup time, the complexity of a hospital system, and that means that it ultimately affects the patient ability and opportunity to be in the clinical trials. We then started Rare Disease Research, which has substantially reduced the amount of time that it takes to start up a clinical trials.
We are now conducting over 50 active clinical trials at our sites in Georgia and North Carolina, and we are opening several additional sites in North America. RDR is a preferred clinical trial site for some of the largest contract research organizations in the world.
We are looking on clinicaltrial.gov for trials, so we reached out to RDR via email, and they were very efficient. They looked at several different sites for us to see which could accommodate our 3 boys, because it's hard to take on 3 boys. So the process of getting into the trial was very smooth.
I would say that this location is great for our boys. They love coming here. The people here are phenomenal. They know us, they know our boys, they remember things about us. It feels much more personal and homey, which is essential.
Our clinical research staff includes several physicians, a regulatory affairs team, pharmacy teams, clinical research teams, as well as local imaging and lab vendors.
And being able to care for the family as a whole, not just the patient. We like to be caring for them, but especially with the pediatric population, that requires just extra love and patience and kindness that we love to give.
Our facilities include exam rooms, overnight stay rooms, a pharmacy, a lab, physical therapy rooms, and even a separate pharmacy for handling gene therapy products.
So again, our goal is for the patient to be able to have all the assessments needed for the trial at our site or near our site. Currently on site, we have different assessments that can be performed, like echocardiogram, psychology assessments, ophthalmologist, physical therapy, and for like MRI, we have a contract with facilities near our site.
We are very proud to work with more than 30 leading pharmaceutical and biotechnology companies sponsoring our clinical trials.
This clinical trial is really important for progression of, helping medicate kids with DMD. We found about RDR through our neurologist. Being local from Atlanta, having such a great facility in RDR, very capable doctors and amazing clinical trial coordinators. One of the things we really appreciate about RDR is the level of care, bedside manner, and for us, they have been fantastic with helping us through this journey.
Rare Disease Research has conducted studies in several rare neurological, lysosomal storage, metabolic and mitochondrial, and other disorders.
So in Rare Disease Research, independent clinical trial sites are part of a multi-center clinical trial. We can start enrolling patients in 30 to 60 days. As a result, there are all these patients at academic medical centers who are waiting to enroll in the study, and they have a decision to make. Do I fly to Atlanta to enroll in a study, or do I wait? It's possibly a very long time for the study to open at local site. And so many of them choose to fly. In fact, 70% of our patients fly from out of state and even out of the country to participate in our rare disease clinical trials. And so to reduce the travel burden for these patients and their families, we hope to open many additional sites around the country to improve access to our clinical trials for everyone.
We can start clinical trials much faster than academic research centers because we do our own contracting and budgeting. We believe we can accelerate the clinical development timelines by at least 2 years.
At RDR, we are able to offer many types of trials with different types of investigational products, whether that's oral, intravenous, intrathecal, cell-based therapies, RNA modulating strategies given IV or intrathecally, and also gene therapy. RDR is IBC certified as a gene therapy center. We're able to receive and prepare and administer AAV-based gene therapies and vectors.
We have developed our own modern cloud software called Devesa Health to manage dozens of trials across multiple sites efficiently. Devesa handles everything from study startup and patient enrollment to source documentation on mobile devices, finance, and regulatory folders and logs.
The exciting about Devesa is the fact that it was developed inside of a clinic, paying very close attention to how people do their job every day. Unlike competitors, we don't try and say, here's the best way to do it. They're able to manage it the way that it's done for them. So you're not having multiple logins from one tool to another. It all happens seamlessly for you with that single login.
We currently have about 32 full-time employees that work in our facility here. They range from clinical research coordinators, clinical research specialists, research assistants. We have our regulatory department. We have our own IT group.
Many clinical trials today can be conducted in the comfort of the patient's home. Since 80% of rare disease patients are children and teenagers, we created a specialized home health service called Gooseberry Research, designed for pediatric and rare disease clinical trials. We hire experienced pediatric nurses and train them at our sites on how to conduct research.
I can never forget that my son missed his elementary school graduation because we had to travel to the site for a trial visit. You know, when you live with a rare disease, every day is a milestone, and it is our mission at Gooseberry to ensure that families can spend more stress-free quality time together when in clinical trials. Joining a clinical trial is a big commitment and a lot of sacrifices, and we want to be there to celebrate their milestones with them.
We work in close partnership with many leading patient advocacy organizations to educate families about clinical research and identify and enroll study participants in studies. In summary, rare disease research is building a network of independent clinical trial sites dedicated to rare disease clinical research, enabled by cloud software and supported by a pediatric research health service to ease the burden of participating in clinical trials for more rare disease patients and their families.